Hey everyone, welcome. This is your P.A.D. test breakdown with my amazing co-host, the world-renowned RVT, Denise Levy. So excited that we have another case that we can learn from. This is, an opportunity for patients to come have their tests looked at. We do not diagnose, not at all. We're only here to simply explain what they're seeing. Everyone's going to Chat GPT, they're going to Dr. Google, and they're looking them up anyway. So we might as well just show them what they're seeing and help them to come up with some questions to ask their doctor. But this is also a great opportunity for other patients to learn from other people's experiences. So, Denise, thank you so much. I love doing this with you. And we have a great
It's
guest
fun.
today. Yeah,
Yeah.
it's so much fun. Um,
Yes.
and you're so helpful and you're so kind, and we just love
Oh,
you.
thank you.
And we have our first friend calling in from the UK. We have Marian who's with us. So pretend Marian has just walked into your office, Denise, and I'll let you both um go from there. Show us what you typically do to get to the bottom of what's happening with these patients.
Well, first, first off, we take a history on the patient. If they're diabetic, smoking, what is their walking abilities? Have they had any prior surgeries? If so, what did they have done? That's basically what you want to know is, do their legs hurt when they walk?
Yeah.
Um, and are they diabetic and smoking? Those are the
Okay.
contributors.
Awesome. So go ahead and ask your questions of Marian as if she is in your
Uh,
lab and you're getting ready to do an ABI or ultrasound.
okay, so Marian, are you diabetic?
No.
Very good. And any smoking history?
Yes, I stopped smoking in 2015.
And you
Oh, good for
smoked
you.
more than 10 years?
Yes.
Okay, so that puts you at risk, being more than 10 years smoking. And when you walk, how far can you walk before you feel any pain? And where do you feel the pain, calf or thigh?
Um, Calf, and it's not consistent. Some days it hurts when I've only walked a short distance. Other days I can walk a couple of miles and it's not
Wow.
really painful.
Oh, interesting. So when you do get the pain, are you walking on an incline? Are you walking on a hill? Any kind of
That's
a
definitely
incline?
worse. It's definitely worse when I'm going
Yes.
uphill. I do find going downstairs difficult.
Oh, going downstairs. And it
Yep,
hurts your muscle calf in your
yep,
calf.
yep. On the outside of my left calf, that's where it hurts.
Outside of
Yep,
your calf. Okay. So usually the outer side is that artery goes down to the front of your foot. So that's the pulse they feel, they call it the dorsalis pedis, and it starts at the anterior tibial, pretty much at the outer upper calf area. So that may have some areas of concern. And looking at your test,
Okay.
it does the pulses and it does the pressures, but it doesn't give us ratios. Um, see, pulse rate is BPM 70, and then if your arm is double that, then that would be a concern where it would be half the amount of blood is getting down by pressure. So that's what we look for. And I think a lot of these are code entries. So it's something that I'm not totally familiar with. But I see a 70 here, but I don't see the arm. I think the arm was over 100, correct?
I think it was one, what
I
was it,
think that
Marian?
that's my actual blood pressure.
Right,
I
the
got
actual blood
is,
pressure.
yeah, my
Um,
actual blood pressure at the time would have been 100 and something over 74, because your systolic is the top line of your blood pressure,
yes,
and your
yes,
diastolic is the bottom line.
Oh, you're down here.
Yeah.
yeah.
So my
Systolic,
blood, right. So my blood
114.
pressure in my arm was
So,
114 over 74.
yeah, so
I
what you
know they
do,
told me that they couldn't get a reading off my left leg at all.
okay. So,
That's interesting that they said that, though, because if you take a
74
look,
divided by 114 equals 0.65. 0.65 is moderate disease. 0.65.
Okay.
I divide the leg and the arm together. I got 0.65.
so
That's the
that means
ratio. That's what
walking
I
could
look
be
for.
really good medicine, right? So walking
Yeah,
is still an opportunity
that's
for
right.
her to use as treatment. It is still the most durable treatment. But Marian, before we get into additional questions, do you want to share a little bit more of the story and how this all began for you?
Yeah. In May last year, I had an attack of vasculitis. Well, I think it was vasculitis. That's not yet confirmed. And because it went on and on, at one point, the doctor discussed the idea of using compression stockings. And so she asked me to have the ABI because she wanted me fitted with compression stockings. After they'd done the
That seems
ABI,
really odd that they want to do an ABI for compression, because typically compression stockings are frontline treatment for veins, which is a
Veins.
venous
Right,
ultrasound, right? So that
right.
is a
but
that just raises my spidey sense.
vasculitis is inflammation of veins, isn't it?
Well, arteries,
Oh, right. Okay. Well, then I don't understand
and
myself.
it's treated with medicine, not surgery.
Yes.
And it's
So,
not treated with compression stockings either, is it,
No,
Denise? No,
no.
I didn't think so.
okay.
Odd.
Well,
Very odd.
there you go. But at the same time, when I get any kind of wound, it's taking a long time to heal. And I think they thought that the compression dressings or stockings would help with the healing.
Where are the wounds?
Right. Where is your wound?
They're on my calves.
Oh, you have wounds on your calves.
I don't
And
now. They are currently
are they
healed.
on the inside part of your leg, like the
No, the back.
inseam?
No, the back.
The back.
The
Okay.
last bad wound
And
I had on the back of my leg, ulcerated.
let me ask you, are your wounds weepy, wet, or dry?
They were weepy, but they have healed
Okay,
now.
that's venous.
Right.
That's a venous wound.
Yep.
Venous wounds are wet and dry ones are arterial.
Yep.
So
that's
you
why.
you
Sorry.
would need a venous insufficiency vein scan to see what veins are feeding that wound. And what they can do is close off that vein. If it's superficial, they close it off because it's feeding the wound.
Mhm. But that's healed up now. But
That's all healed
yeah, it healed.
completely.
Yep,
Okay,
it took about 5 months to completely heal, but it has
that
healed.
sounds about right.
But because when they'd done this ABI, they then said I had to go in and see the doctor because of the results of the ABI. And when I went in, she said, your ABI suggests that you have peripheral arterial disease.
Yes.
Correct.
And I want to start you on a blood thinner. And that worried me because I've been on a blood thinner since 2015, along with statins since I last had a stroke. And my doctor doesn't know that I'm already taking a blood thinner. I found that a little bit worrying, but never mind. So I asked about it and I said, does this mean that like the blood's not flowing properly? She said, yeah. So I said, well, are you going to refer me to see a specialist about this? And she said, no, because I think it's all been caused by the vasculitis and you've already got a referral to see a dermatologist.
No.
Now, the referral to dermatology was made in May. My appointment should have been at the beginning of January, but it's been cancelled and there are no further appointments available. So I'm not seeing, the GP won't do anything anymore.
So
because
you
I need
have
to
never
see a
seen a
specialist.
vascular doctor. You've
No.
never seen a vascular
They
doctor.
won't
Yeah,
refer
you
me
need
to
to see a
vascular
vascular.
doctor. She
You
said
need
she
to
wouldn't
see a
refer me to
vascular.
vascular until after I've seen dermatology, but there are no dermatology appointments available in my county.
So she has
Oh,
peripheral artery disease, possible chronic venous insufficiency, and she has not been referred to a vascular specialist to handle the source of what's
right,
bubbling up to the skin.
right. Yeah. I would definitely want you to have a scan, number
So you've
one.
never had, even with those wounds, when she was talking compression, I assume she had it in the back of her head that there was some chronic venous insufficiency. You probably have some
Right.
swelling,
Yeah.
I would imagine, in your legs.
Yeah, the wound ulcerated. It was a mess. It took a very long time to
Now
heal.
there is such a thing as venous claudication. So if you walk a while, you can actually get venous claudication as well.
Oh, I didn't know that.
What's
Can you talk a little bit
claudication?
about that, Denise?
Well, your legs get swollen and tired, venous
Yeah,
claudication, and you recover a little faster than you would with arterial. Some arterials, it grabs you really tight, whereas the venous, it's kind of like a gradual pain, numbing pain, more than a sharp pain in the muscle itself.
it's like muscle spasm pain. The pain I get, it's like when I get, because I get muscle spasms on my right hand side since I had my stroke, and the pain is like that sometimes, and it goes down into my toes. My toes curl in.
Oh, okay. So number one, I think that you need a scan, arterial scan. And you've never had a blood clot in your vein? They put you
Um,
on a blood thinner for your stroke, but not for your
yeah,
legs, correct?
yes, that's right. And
Okay,
because I'm already on the blood thinner, she said that the treatment that they would recommend for the P.A.D is to go on to blood thinners and
Did she say which one? No, because you could be
statins.
on, so you have antiplatelet and anticoagulant.
I,
What
I
was it?
I take clopidogrel. I don't know which one that is.
That's an antiplatelet. So is she
Right.
talking more of an Eliquis or Xarelto type of thing, or generic form of that?
I don't
You don't
know.
know.
When I pointed out to her that I already take clopidogrel, she said, "Oh well, we won't bother then." Um,
It's really interesting to me. I think that there are some general practitioners that don't know that there's a difference in use case for a clopidogrel versus like an antiplatelet versus an anticoagulant. And I'm concerned with, her having the stroke and then, her
right,
legs having issues that I would have, that there might be a grander clotting situation that might
yeah.
require a different approach.
And you don't have a clotting factor problem like factor 5?
no,
No. Okay.
Have
no.
you
Well,
been
again,
tested
Well,
for any clotting
I think they
disorders?
need to do a scan and locate any arterial disease that you have. Because
right.
if those numbers are correct, you have moderate disease. And usually they want to do something with moderate disease. If it's mild and you're walking okay, they probably won't. But it's moderate. It's 0.65, which puts you in a moderate category.
And in the
Um,
UK, if you don't have a wound on your foot that is not healing, they tend to lean towards conservative treatment. So they may, say, hey, we have a walking program, supervised exercise therapy program, or they'll tell you, here's the medication, just go home and walk a lot. And if you get a wound on your foot that doesn't heal, then give us a call and we'll get you in within like 48 to 72 hours. But walking is going to be number one, what they will like to tell, and I would ask
Right.
them about that. But then number
I
two,
looked on
so
the NHS app for advice
yeah,
before I joined this group, and it told me to get my blood pressure down, but it's not high anyway. I actually occasionally have a problem with my blood pressure dropping too low, and that makes me feel really ill. The other night it was 74/48, and I felt absolutely dreadful.
Oh yeah. Yeah.
do you
That's
have a
way too low.
cardiologist?
Nope.
Okay, so we're going to do something about that. We're going to go offline, and actually I'm going to work with you on getting helping to navigate, because we're working
They
with
gave
some
me
different doctors across the NHS.
they gave me a blood pressure monitor for a week and said that because over the course of a week my blood pressure's averaged out at normal, they didn't need to do anything.
Yeah. Yeah, we just, honestly, we're going to have to we're going to find out and make sure that we are that everything's above board, that all the protocols as per the NHS guidelines are being followed, and if they're not, we need to find you a care team that is going to align with standard protocols for the NHS. But number one, as Denise was saying, you need an arterial ultrasound. Number two, Denise, correct me if I'm wrong, if she hasn't had a venous ultrasound as well for those weeping wounds on her calf,
Right.
even though they've healed right now, she should have a venous ultrasound
Definitely.
as well.
Right.
So those are
Right.
two things that you need to have the conversation with your doctor, and you need to say, I have wounds that keep reappearing on my calf. They're weeping. There's signs of chronic venous insufficiency. You talked about compression stockings, doctor. I'm assuming that's what it was for, but can we have an order for a test, a venous ultrasound, to confirm where the issues are happening in my veins? And I understand compression stockings are frontline treatment for that, but let's just make sure. And then number two is, you were saying that you can't feel my left dorsalis pedis. I do have that claudication when I'm walking. It's an issue. I have moderate disease. Can we order a follow-up arterial ultrasound as well to make sure we confirm what's happening there? Does that all sound and feel right?
Yes, apart from the wounds that I've had, they didn't just appear. One was a dog bite, and one I fell and split my leg open. So the wounds were, I know what caused the wounds. It's just that they
Right.
took so long
They
to
didn't heal.
Yeah.
Exactly.
Fact that they didn't heal normally could be arterial situation.
Right. That would make
It could be arterial
that
or
makes sense to
venous,
me.
or
Yeah,
do you think
if it's
arterial?
not healing, it could be arterial,
Right.
Oh, that
slow
too.
to heal.
Okay. So we need to get to the bottom of exactly
So it was
what's
a
going
dog
on in
bite,
your
not
vessels.
a varicosity. Okay, so that's
Okay.
different.
Okay. That's important. So when it comes to venous wounds, do they simply appear? They just kind of work their way into a wound, versus arterial?
Yeah, arterial
Okay.
is usually dry. But in her case, she might have had infection because it was a dog bite.
Okay. Yeah. So we still have a lot
But
to get to the bottom of, Marian. So it seems like you do need a chief investigator on your team, and we'll help you sort that out and find that. But hopefully, do you have any other questions for Denise, though, just on what you know, she saw with your results, the limited results that we do have, that would make you feel comfortable in moving forward with your care team and asking the right questions?
No, because from what I can gather, because they're coded, you don't really understand them. So I need them to tell me what they mean. So I think what I'll do is try and make an appointment with the senior GP at our surgery, because so far I've only seen the junior ones.
Uh-huh.
Yep. Good for
And
you.
try and say to him, right, you tell me, what does this mean? And why do I not need to see somebody who specializes in circulation? Why am I
Right.
being
Or
told that I need to see a dermatologist?
how
When,
how about reframing that? Because if it's a different doctor and it's a
yeah,
senior level doctor, I would simply reframe it and say, instead of saying, why can't I, just say, would it make sense for me to see
yes,
a vascular doctor if there's something
vascular.
deeper going
Word.
on
Yeah.
in my arteries and veins?
For 2 days.
And the
So that
doctor
would be
did,
great.
yeah, and the doctor did come out and say you do have some arterial issues.
Yes.
So, I mean, that should be at the forefront of their concern.
But the doctor I saw that I did see told me that they thought that the reason that it looked like I had P.A.D was because of the vasculitis. But if I'm not mistaken, one is arteries and the other is veins.
Well, the vasculitis was treated prior.
Yep.
Doesn't it can cause some scarring, vasculitis.
Yep.
But it's, you know, it's mostly treated medically because it's an inflammation of the artery.
Yeah.
Um, but your ABI, your arterial test was done after you healed from the vasculitis.
Yeah.
Yeah. So um, it's not like you have an event going on now, but I would just go back to the fact that your test for the artery was abnormal
Yeah.
and that you wish to pursue uh, that before, you know, it gets any worse.
Yeah. Thank you.
Thank you so much, Marian. Hopefully this is helpful. Keep coming back. Let us know what happens. We're here to support you. Happy to reframe some of this in a private chat between us. I can remind you of some of the things and maybe help see if there are ways in which we can help you navigate the system over there to get to a vascular doctor who can help you get to the bottom of what's really going on. So thank you so much for your courage,
Thank you
sharing
very
your
much.
story. I think a lot of people are going to learn from this. And thank you to Denise. And if anyone else wants to participate and have their scans read, again, we do not diagnose. We only let you know what the words mean and what the numbers mean. We help you to then use that information to have a more productive conversation with your own care team. We understand and recognize that people are getting the results before their consults, and just there's a time between the two that can cause anxiety and stress and depression, because whoa, what's happening with my body? I don't have answers. I feel something and no one seems to be doing anything about it. And how can I channel that energy? And hopefully we're able to, with these sessions, help you to channel that energy into creating or preparing for a productive and satisfying conversation with your care team by having a critical list of questions that you can ask in preparation for that meeting. So hopefully this has helped. Email us at info@padhelp.org if you want us to review your scans. And remember, this is for educational, informational purposes only. Do not act on any information provided here at all without explicit consent from your own healthcare team. And don't forget, if you want more great content like this, do like this video and subscribe to our channel. Thanks everyone for joining us.